Dr. Prashant, we can start.
Okay, thank you. I'm starting, sir.
Yeah, yeah.
Hello, doctors. Good afternoon and welcome to this webinar on the role of oseltamivir in flu management. We have got moderator Dr. Kapil Rathi, sir, with us. Welcome, Dr. Kapil Rathi. This webinar is brought to you by Hetero Healthcare, an innovative pharmaceutical company. For Hetero Healthcare, the journey began in 1993 and we have got 30 plus years of excellence, 36 state-of-art manufacturing facilities and 300 plus products in portfolio. Hetero Healthcare has presence in 126 plus countries and has 21,000 employees globally. Hetero Healthcare is the largest closely held pharmaceutical company in India and is amongst the largest manufacturers of ARV, APIs and FDFs in the world. Hetero Healthcare is Asia's largest API manufacturing, has Asia's largest API manufacturing facility at SEZ Complex, Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Hetero Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Hetero Healthcare, the pioneers in antivirals, offered Oseltamivir, Favipiravir, and Remdesivir to the patients, because of which in August 2020, Hetero Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, role of oseltamivir in flu management. As I said, we have got Dr. Kapil Rathi, sir, with us as moderator. Dr. Kapil Rathi is Medical Director Consultant My Health Clinic from December 2006 till date. Sir is working in general and critical care medicine for last 19 years and is well equipped with all the general medicine, chest medicine and critical care procedures. Dr. Kapil Rathi, who has been awarded by Governor of Maharashtra for excellence in work during COVID times. That's great, sir. Sir has been part of trials for MNC and National Pharma in phase 2 and phase 3 trials, has been working with various NGOs for health awareness by conducting camps. Sir is Fellow of Infectious Disease by IDSA, member of ERS, ATS, ACP, IDF, ADA, RSSDI, ICP, and Sir has held multiple positions in various bodies. Welcome, sir, and over to you.
Yeah, thank you. Can you listen me properly?
Yes, sir, clearly.
Okay. So, good afternoon to everyone who have logged in, and thank you, Hetero, for inviting me. We'll discuss something on empirical use of oseltamivir in flu management. So, it's a very simple topic, and I'll try to keep it more simple and try to give you a little bit of idea about what are the antivirals which are available and how we can use it rationally. So, we will have, a bit of talk on challenges in the diagnosis, what are the complications, what are the clinical evidences to use oseltamivir, and what are the guidelines, what they recommend us to use empirically oseltamivir. Next slide. So if you see healthcare related challenges in monsoon, not only in monsoon, but around the year in city like Mumbai or in country like India, we have got influenza like illness, we have got H1N1, which is most deadliest of all, and severe acute respiratory illness because of any viral illness, and COVID-19. Obviously, COVID has been now more or less gone, but we are still fighting with and will be fighting with influenza like illness, H1N1, and SARI. Next slide. So if see you Indian data right from 2017 to 22, we can see the year-wise number of the cases which have gone up till 21 and 22, where they were little low because COVID was there. So otherwise everything was recorded as COVID, not as a flu. But yes, in a given year, in last 5 6 years after COVID has been gone, we are seeing that there are flu cases which are going very up. As an not only very steadily but very aggressively, and also we are seeing more death because of flu infections. So this is the story in last 4 or 5 years that we are seeing exponential rise in flu cases. Next slide. So if you see the overall or overview of influenza in India right from 2015 to 20, you will see the number of cases are going high, and as the cases are going high, there are more deaths. So जितनी ज्यादा cases बढ़ेगी उतना ज्यादा आपको death मिलेगी. So कहने का मतलब ये है कि flu is not a very simple disease. It is a very catastrophic. It can cause death also. So we have to treat them very judiciously and very aggressively. Next slide. So why we are discussing flu? Because it's a one of the most important virus which is very ubiquitously present across the world. And there are 4 types of influenza virus what we are discussing: A, B, C, and D. In fact, C and D's are basically very mild variety of flu virus, and they don't infect human. They'll infect more on a monkey or a swine or other things. Uh, uh, Influenza A and B are the most commonest, and out of that, A is the most commonest virus which we all deal with in a day-to-day practice. Almost 80 to 90% of flu infections what come to our OPD are because of influenza A virus, and influenza B is very mild virus. It affects human being, but it's a very mild kind of illness. What happens because of B? Next slide. So you understand there are two types of A and B. How does they transmit? They just transmit like a any other viral uh, 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 virus, basically, like how the COVID was there through respiratory secretions, droplet, handshakes and other things. So if anyone who's infected with flu is present within the vicinity of 6 to 8 feet of a given person, he can transmit that through a respiratory coughing or sneezing or a droplet infection. That is very important. Therefore, it is most important to understand that patient should follow the simple protocols if the patient is suffering from the flu. Most of the healthy adult may infect other people beginning from day one before symptom develop up to 5 to 7 days. So generally the incubation period can be from first day to fifth day, and patient can be vulnerable or can transmit infection to the other person within first to 5 to 7 days of the infection. That is very important. And children might pass it for more than a week time. Next slide. So how do you differentiate between influenza like illness H1N1 सारी and COVID-19? I think this is the most important slide. अगर आप देखोगे इसमें पहले 5 symptoms like fever, myalgia, cough, lack of energy और sore throat, they are common with all these viral infections. ये सभी में होता है. जो भी पेशेंट आपके ओपीडी में आएगा आपको ऐसा ही मिलेगा, इन चारों पांचों सिम्टम के साथ ही आएगा. But if there is a breathlessness, then you can, maybe you are dealing with some kind of a severe flu, or you are dealing with H1N1 or SARI. Loss of taste and smell was very peculiar with COVID. Diarrhea was also very peculiar with COVID. Headache and everything can be present or cannot be present. So there are very subtle signs which will differentiate one from other, but most of them will come with the same symptoms. Next slide. So if you see the emergency warning signs of flu sickness in children, basically you can, so if there's a cyanosis, if there's a tachycardia, tachypnea, if there is a rash, or if there is a severe diarrhea, or patient is very irritable, these are the very important clinical signs where we need to admit this patient or we need to see very closely. While in adult also the same things, if there's a tachycardia, tachypnea, confusion, rash, or maybe shortness of breath and other things, you might be wise enough to admit this patient to in a hospital for monitoring this patient. So these are very important. Next slide. So these are some emergency signs where we can judge the patient. Why it is important? Because there are a lot of complications of flu, which include not only pneumonia, bronchitis, ear infection, or worsening of asthma, COPD, but also ARDS and death. There is a wide variety of infections and complications which occurs because of flu. Next slide. So how do you treat this? So treatment is mostly symptomatic in most of the patients, like bed rest, increase water intake, avoid dehydration, cough suppressants, NSAIDs, or maybe a paracetamol, something like that, which is there. Most of our patient will recover in 3 to 5 days of infection. Most of us, 60-70% of patient, but 30-40% of patient might go into a second stage or category B or C, where they require little more aggressive treatment or more time to recover, and that is very important. So how do you decrease this kind of the symptoms of the patient, and how early we treat is the very important determinant of a patient's outcome. Next slide. So if you see this treatment, there are two antiviral drugs which are available for flu. ये सबसे इम्पोर्टेंट है. हम लोगों को सब पता है एंटीबायोटिक एंटी फंगल, बट एंटीवायरल के बारे में ज्यादा पता नहीं होता है. But the drug like Oseltamivir, which is a neuraminidase inhibitor, it is available for so many years now in our country also, and we should try to use him in these patients who are who present to us very early in the infection. So there is a neuraminidase inhibitor which block the viral neuraminidase enzymes, which is critical in releasing virions from the infected host cell, and these drugs are active against both A and B influenza. The examples are oseltamivir and zanamivir. Well, there are adamantins like M2 ion channel blockers, which interfere with hydrogen ion channel activity of the influenza A virus. Therefore, it blocks the entry of virus into the host cell. The problem is that it is only active against A virus, and it is a very weak drug as compared to neuraminidase inhibitor. The examples are amantadine and rimantadine. So most important drug being oseltamivir, which is a neuraminidase inhibitor. If you see the next slide, uh, It's a potent and very selective inhibitor of neuraminidase enzyme of the influenza virus. It is a very important drug. It's a pro-drug. That means it's not active drug. Once you take that drug inside your body, it goes into the liver and get activated, and then it acts against the infection or the flu virus. It is effective against all strains of influenza A and B, which include H1N1, H5N1, or H9N2, all the strains which are available. So that's the most important part. It is not only effect against the simple flu, but it is also active against all the bad flu also. So it will basically it is a good inhibitor of neuraminidase enzyme which is present over the flu virus. Next slide. So if you see the mode of action of oseltamivir in this cartoon, you can see the spikes. There is a virus, there is a protein, there are the spikes. So if you see the orange spikes, they are neuraminidase, and if you see the blue spike, they are hemagglutinin. So once there is a neuraminidase inhibitor like oseltamivir, you can see in the lower part of this cartoon, they go and sit on the dumbbell-shaped neuraminidase, and it will block that neuraminidase enzymes. Therefore, it will prevent the release of virion into the host cell, and therefore it will prevent the viral replication, and therefore it will halt the infection. So this is as simple as mechanism of action of oseltamivir. Next slide. So it's a first oral neuraminidase inhibitor which was approved in more than 100 countries. It is approved by FDA, CDC, and all the important and major societies across the world. Next slide. It is also available in India for so many years. The dosings are very simple. क्या करेंगे हम लोग 3 मिलीग्राम पर किलोग्राम के हिसाब से कैलकुलेट करेंगे. सो अगर आप 50 किलो के हैं so if you multiply 3 milligram with 50, it becomes 150 milligram. You have to give it in two equally divided dose after meals. So अगर 50 किलो के है तो multiplied by 3 becomes 150, and you divide it into two doses like 75 milligram सुबह, 75 milligram शाम में after food. The good part is that it is not only available as a tablet form but also available as a syrup form. Therefore, it can be given into pediatric population and also in the sicker population who are in the ICU through IELTS tube. And the doses are again simple 3 milligram per kilogram divided into equal dose. Very simple. Next. So benefit of using of empirical uses of oseltamivir not only decreases the viral infections or viral replication, but also it will decrease antibiotic misuse by almost 30%. So you don't have to use antibiotic if you're using proper antiviral because that is the drug of choice. Plus, it will decrease the influenza-related complications like LRTI, pneumonia, and other things. And most importantly, it will decrease hospitalization by 50 to 60%. छोटी सी चीज के लिए आपको हॉस्पिटल में जाने की जरूरत नहीं है. आपके ओपीडी में if you give फ्लूवीर or oseltamivir, patient might get better in 3 to 5 days. That is most important. Next slide. And this is proven in so many trials. So it decreases the occurrence and severity of pneumonia. That is very important if you give early oseltamivir. And most important thing is that in our practice, generally we take almost 4 to 5 days to start a kind of an antiviral, which is a wrong practice. The moment you see the patient first time in your OPD and you feel that this is a very classical or a pakka case of flu virus, start oseltamivir, start fluvir. At that point of time, it will give wonderful result and it will help your patient. Next slide. So if you see this graph, it also shows that both the probability and the severity of infections will go down if you use early oseltamivir. That is very important, and they will not only decrease the pathogenicity, but they also will decrease the symptoms and the complications because of flu. That is very important, and one should use as early as possible, preferably in first 48 hours of the infection. So जितना जल्दी यूज करेंगे ओसेल्टामाविर उतना जल्दी फायदा होगा. That is the crux of the story. Next slide. So there are guidelines which recommended oseltamivir, like WHO says, empirical treatment is strongly recommended. There are very few drugs, or there are hardly any drugs which can be used as empirical in clinical practice. One of the drug is oseltamivir, where you can use whether patient is tested or non-tested, whether patient reports come positive or non-positive. Still, we can use oseltamivir as an empirical treatment in a given patients, in a given locality, in a given epidemic, because the benefits are far, far more way than the negativity. So that is most important. Next. So WHO recommended this. So empirical therapy includes a neuraminidase inhibitor for treatment of influenza, where the local circulation or other risk factors, like when a very sick patient or a very poorly immunocompromised patient, you can use empirically in this patient so that patient doesn't suffer from flu and don't go into complications. Next slide. So, in adult with CAP who test positive for influenza, should the treatment regimen should include antiviral therapy? Yes, it is very important. So, any patient who test positive has to be given. There is no doubt about that. But even in a patient who don't test positive, but still you feel clinically that this patient might be have a concomitant flu, you can start antiviral for 5 to 7 days depending on the patient. But most important thing is that don't miss that window of first 2 days. That is most important. If you start within first 2 days of the infection or the presentation, I think that is the best time so that your drugs can act in a proper way and you don't land up in a complication. Next slide. So to summarize whatever we have discussed till now, proper diagnosis can and early treatment can prevent flu complications. We all have seen that and we practice that. Empirical use of oseltamivir reduces LRTI, hospitalization, and antibiotic use. It goes without saying. This is one of the most important things to be remembered that you should use empirically oseltamivir in a given patient. And all the societies, including WHO, ATS, and MOHP, recommended empirical use of oseltamivir. I think this is the bottom line is that we should suspect flu. In fact, once we suspect, we should start empirical use of oseltamivir for 4 to 5 days or 7 days maximum, depending on the patient. It's a very simple drug to use, very easily drug to monitor without having any side effect or without having any major problem. So one should use oseltamivir or fluvir in a given patient. Thank you so much.
Thanks, sir. Some commonly asked questions by the doctor. Sir, do you feel the incidence of viral infection? You did mention that the incidence of viral infection has increased. Possible,
Yeah,
I
yeah.
suppose, because of the immunity debt, I suppose.
Yeah, yeah. So, you know, viral infections are always going to be there because viruses are more than bacteria in the world.
Correct.
So,
Correct.
viral infections will always be there, and virus is present across. It's a ubiquitous. It is present everywhere and anywhere. And possibly because our immunity is going down day by day, the climatic changes are there, the environmental changes are there, the pollution are there, not properly, hydration is not there. So there are a lot of things which are happening with us in day to day, in our life. And possibly that is why the viral will always get over the human being. So viral are getting, higher and higher infections.
Yes. And of course, the patient will, the a child may be brought to the doctor very little early, but otherwise, adults and seniors may not be brought to the doctor so early.
Yeah, yeah. So I think it's a very common practice in India that patient will have his own घर की therapy, then
Yes.
will have 1 day ka medical ka therapy directly OTC.
Yeah.
So possibly they come on day 3, day 4 to a general practitioner
Correct.
most of the time. So if general practitioner misses that opportunity or that window of day 3 or day 2, then possibly once they come to me, like consultant like me after
Further
4 or 5
late.
days,
Yeah.
so possibly we have missed the that window of
Correct. Correct.
using oseltamivir early. We can still use, but the results will not be that great. So I urge all my fellow colleague, fellow practitioners, and general practitioners try to use ASAP as soon as possible. The moment you see the patient, use the drug, which is very simple drug to use and very effective drug.
I mean, you have already said this. The clinical response will depend on only the how early it is started or any other factors on which clinical response will be affected.
Yeah, so clinical response depends on obviously how early you use. That is one
Yes.
thing. Two, what is the general condition of patient,
Correct.
comorbidity of the patients, the living conditions, the rest. The rest is also very important. A lot of
Oh,
people do, they take medicine and they go to work for,
okay.
because.
Okay.
So if you take rest, at least give 40 hours of break to your body, possibly you'll recover more fast. Dehydration
Physical.
should be avoided. So these are all simple common factors which everyone knows, but very few people follow. That's the problem. So you should do all these things together along with an good antiviral like oseltamivir that will do the trick.
Generally, for how long you have been prescribing Oseltamivir?
Yeah, so the standard guideline is 5 days,
5 days.
for most of the patient, and after 5 days, mostly your virus will be out. Your incubation period is gone. Your body will take over the immunity will take over your whatever is the innate immunity. So you should use for 5 days, and maximum what we use is for 7 to 10.
7 days. And rather, I mean, people will be very comfortable using antibiotics concurrently.
Yeah, I mean, this is very inseparable. This is how the our knee-jerk reaction is.
Correct.
The moment we see patient, 2 दिन से दवाई खाया कुछ हुआ नहीं, and they suddenly come to you. The first thing will you write is a maybe an some kind of acyclovir and maybe an
Yeah, yeah,
antibiotic. So
correct.
that's a very common practice what all people do. In fact, including me also, I'll do. But you should think twice before writing an antibiotic in a flu patient or in a very classical flu patients. I'm not saying you should not write, but then at least think, ask, and just give 2 minutes to yourself whether this patient requires antibiotic or not. So if there is a very subtle signs of flu only, possibly you should avoid antibiotic and just start antiviral. But if you
Correct.
feel that there are other factors and patient is a very severe or very sick enough or comorbid, then probably you are justified in writing antibiotic.
So you leave that decision to the doctor, whether he
Yeah, yeah,
needs.
but but
Yeah.
but don't forget antiviral. That is most
Yes,
important.
yes, yes. And sir, in your experience, how it is tolerated? Any contraindication, any major adverse effect?
Oh, it's very well tolerated. Means, I mean, whatever little experience I have for those last 4, 5, 6 years, so it is one of the very simple drug and very easy drug to tolerate without having any complications or without having any major drug-to-drug interactions or any adverse side effect where I have to stop the drug.
Correct.
Hardly. So possibly one of the safest drugs. So don't worry about tolerability. It is just about willingness to write.
And precautions, of course. And your overall message, overall experience, take home message for the audience.
So again,
Mm.
I'll emphasize on the same point. Antivirals are the drug of choice for viral infections. There are very few antivirals which are available in the market, and out of that, there are oseltamivir is one of the first come molecule in the market. Very simple molecule to be used and very effective molecule to be used. Very commonly used for the patients of flu, which are again the commonest patient in our
Correct.
practice. So I think overall one should have that concept of antiviral to be used, and don't miss that window of first 2 3 days where patient comes to you and then you think of using antiviral after 5 days. Once patient doesn't get response, I think patient will respond, but probably we have actually
Yeah, yeah.
waste that 2 3 days which patient might have been recovered if we could have used that very early in the disease. So antivirals are there. Use judiciously. Use confidently. Don't worry about any major side effect or anything, and they are very safe drug to be used.
Can be used empirically also without,
Oh yes, yes,
that's
that
what
is one of the
guidelines
most
suggest.
important. Yes,
Yes.
yes. People use means most of all of our patients are used empirically only. We don't
Empirically.
test for all
Correct.
our patients.
Correct. Correct. Right, sir. Thank you so much. Thanks for sharing
Pleasure.
your experience, and thanks all the doctors who took time from their busy schedule in the afternoon and attended this. Thanks once again, sir. I'm sure it's very informative for the general practitioners. I mean, getting them confidence of using a drug straight away empirically without any side effect for a common condition like influenza, which will put their patient back on track very soon, is a very nice thing. So thank you
Thank you.
once again. Thanks all the doctors. Thanks Sanjana. Thanks Payal, and thanks all the sales team for this coordination. Payal, you want to add anything?
No, sir, I think you pretty much covered everything. Thank you
Yes,
so much,
yes.
sir, for your valuable time. And I thank all the doctors for taking out their time and
Correct.
coming to attend the webinar.
Correct.
Thank you all so much. Have a great day.
We'll
Mm.
see you, sir, on Wednesday.
Thank you. But yeah, yeah, surely.
Yes. Bye bye.
Bye bye.
Bye.